Hey, this is Paul. If you're on my website right now, you're probably a little bit confused as to what physiotherapy is and what it actually does. And if that's you, you're definitely not alone. A lot of confusion exists over physio and whether or not it's right for certain injuries. So I'm going to give you a little bit of an insight into physio, what we do and how it can help and whether or not it can help your particular problem. The reason the confusion exists, if you think about it like this, when you're a kid, you know if you have tooth pain, that it's the dentist to solve your problem. The problem we have as physios is there are a lot of people who potentially can solve your problem. Do you choose the osteopath? Do you choose the chiropractor? Do you go for the doctor? Do you go for internet advice these days? Do you go to A&E? So you've got a lot of options, and what we find is that the more options that somebody has, the longer that they wait to get the problem solved because they're a little bit worried about getting that decision wrong. So let me tell you what physio actually does and what injuries it treats. First of all, physio is definitely very physical. You've got to expect that a physio is going to put their hands on you. We do it very respectfully. It is going to be a little bit painful, but we aim to be as gentle as we possibly can when it comes to things like massage or manipulation or stretching. We're basically trying to get joints and muscles moving. And that's often the reason that you're in the pain that you're in, is muscle is really tight or a joint is locked up, particularly if you're between the age of 40 and 60, when you start to get these type of problems. But they really are very simple to treat. It's just that the longer they go on and the longer that they get left, the longer it takes for a physio to actually help. What's the best thing about physio?
The massage is quite nice.
Not the pain that I caused you?
No, the pain's fine. And obviously, it for me personally, it reduces a lot of stiffness. I feel like I have a lot more mobility after I've had the physio treatment.
What about coming here? What do you enjoy about coming here the best?
It's relaxed, I guess, relaxed atmosphere and recommendation, I suppose.
If you had a friend who had a bad back or a shoulder or neck, would you recommend physio?
Of course.
How would you describe it?
Yeah, of course, yeah.
How would you describe physio? To your best friend. Imagine your best friend's got a bad back. How would you describe it to her?
How would I describe physio? I suppose manipulation to free up the joints. With that little, I don't know what that is that you do.
Crack.
I don't like the crack thing. Yeah, not too keen on the crack. So I just tell them to hold the breath when you do the crack.
Shut their eyes and put some earplugs in, basically.
And don't yell like I do.
You're going to get plenty of time to ask questions in physio, and I would say if anybody asks me what's the benefit of seeing a physio, the hands-on treatment and everything that you get in that respect is obviously great, but the number one thing I find that patients love is that they get to ask questions. Many places that you go these days, nobody listens, particularly possibly your GP or you go to the NHS, they're not always listening to what you say, and when it comes to these type of injuries, it's the physios who are the experts. So we're in a great position to give you the advice when you do ask us the questions and kind of fill in the blanks that you want to know about why your injuries caused, what happened, what part of the body have you actually hurt, and obviously importantly, will it happen again and how long will it take to go? So you get plenty of time with us to ask those questions. How would you describe physio to somebody? Because obviously now we've tried your wife and we've tried both of your kids.
Yeah.
When they had injuries and you were kind of nudging them towards coming in to see us,
yeah.
What did your wife say? Did she have any questions about what we might do or what physio would be? And what did you say to her?
The way I explain physio to them is with a car, if you service your car, you get it MOT'd, but you leave your body, you neglect it, and you need to get it sorted, you need to get it looked at. And as soon as something goes wrong, you know now. And my kids come in, they play rugby and football, so they have injuries, they get sorted. My wife Nisha, she's been in a few times, and it's just easy and it's something that you've got to do. And typically you can expect a session to last anywhere between 30 and 40 minutes, although we do give you the option of a 1 hour session if you're in a lot of pain or you've got a hell of a lot of questions to ask. That's there for you as well, but typically you're going to expect a session of about 30 to 40 minutes long. One of the big problems, people just ain't sure if physiotherapy is right for them. As I've said, and all these things, the confusion over chiropractors and doctors and osteopaths and who you should choose for your problem, actually means that some people will wait anything up to 3 months. Now, I spoke to patients and speak to people, and I will ask them why they waited, and those are the reasons that they eventually will give you, that they just didn't know what to do, or the classic, and this might be happening to you, is that you just pretty much go to bed every night hoping that tomorrow is the day that you're going to wake up and your problem's gone. And I would guess if you're a week or two down the line after injury and that hasn't happened, then your problem's not going to go away and you need to see somebody like a physio. How long did you wait? So you was it squash you were playing at the time?
No, I think that was 5-a-side at the time, but
So
invariably I think I left it too long, which I've learned from that you've got to as soon as you've had the problem to get yourself in, because if you leave it too long, you think it's going to repair itself. It doesn't. It's spoilt what you've been wanting to do for the next month. Whereas if you'd have gone in straight away, you'd have been fixed quicker.
Injured. How long did you sit every day and wait for it to get better?
It took me ages, and the injury kept reoccurring with my knee, and then I was taking time out again, and then having to get back into the training again, and then eventually you just get so that enough's enough, and then you pick up the phone and you take the first steps to getting it put right, and you realise you should have done it probably 6 months earlier.
So do you think it took you 6 months?
Probably. The first time.
So what did you do in that 6 months? What was your kind of escape route to try and find information or to get help? What would you have tried?
Well, you do the usual thing that everybody does now, and you do the Google search, which frightens the life out of you, and you self-diagnose yourself and then panic, and then you probably rest for a little bit and think that it is getting better, and you're just making it worse, or it's not getting any better.
So to confirm the injuries that we can help you with, back pain, definitely, 100%. I would say 7 out of 10 of the injuries that we see are back pain related. Shoulders, definitely through poor posture. We were never designed to sit as often as we do. So if you're sitting at a desk all day, or you're driving, or you're on the computer a lot at home, it's probably no wonder that you've got the shoulder pain and tension up around your neck and shoulder area that you have, because those are the reasons the pain can come up. Really, really poor posture, sitting all day. We really weren't designed to do that. So as a result, physios are seeing a lot more of these type of sedentary injuries where there's no real reason. They just come on, you wake up one day and all of a sudden the pain is there. And that's the injuries that usually people wait the longest to do something about, because when you fall over or when you slip, you have a car crash, you know that you're in pain, you know there's an injury, and you go and see somebody about it. When that pain just kind of creeps up on you and you can't really put your finger on why you've got it, those are the injuries and those are the people that tend to delay what to do or where to go to get their problem solved. We use treatments like massage for those type of things. So for shoulder problems, for back pain, for neck problems, we might use a little bit of mobilisation or manipulation, and all that means is basically that we're going to give a muscle or a joint a bit of a nudge. If it's really stiff, we just try and push it and we get it moving, and then we give you the exercises that you can do at home to help yourself. And other injuries that we might be able to help you with, for example, sports injuries, they're dead easy to treat. Things like ankle sprains or knee twists, hamstring strains, groin strains, there's bread and butter when it comes to physiotherapy, and that just needs a lot of massage, the right stretches, and the right advice as to when you should begin your running again or when you should get back to activity. Because the classic mistake that people make is that they pull a hamstring or they injure their back, they're rested for 2 weeks, the pain kind of goes, and then they go back to the running or they go back to doing whatever they were doing, and the pain comes back. That's just the way it goes, because the problem isn't solved. You've just rested it and you haven't exposed it as much as you would, because you've obviously been trying to protect it. Through it all, as I said, it is painful and it is physical, but we'll always explain to you what we do. So if we're doing things like manipulation or massage or stretching, we'll tell you every step of the way what we're going to do to you. And at that point, if you don't like it, or you've had it in the past and you know it doesn't work for you, you can jump in pretty quickly and you can tell us that it isn't for you.
No.
Didn't you say that someone had done something that you always ask them not to do something and they just go ahead and do it anyway?
Yeah, the one of them, osteopath, I went and told him I had the bad back and I had bad neck. And I said to him, under no circumstances I want you to crick my neck, because you've done it before and it's hurt me, and I've gone away and I've been in more pain. But he used to just ignore me, do the usual stuff, and then at the end of it he'd come to the top and he'd crick my neck. And
we'll always aim to give you exercises. Now, exercises are good because they'll help you, but they're not the be-all and end-all of solving problems, particularly things like back pain. They will help and they go alongside the treatment and they support the hands-on treatment that the physio will give you, but they're definitely not the only way that you're going to get your problem solved. So be very wary of anyone that you see or any place that you go that tells you that it's exercises that you need, because it ain't. More often than not, 19 out of 20 times, you need hands-on physical treatment to release the joint, to massage and relax the muscle, and then the exercises help because they stop it from coming back. So the exercises are important and they run alongside your hands-on treatment, but they're definitely not the be-all and end-all of physiotherapy. And the other thing that I think patients want to know when I speak to them about physio, they want to know what happens if we can't help. Physio can't help every injury, definitely can't. If you've got, say, a cartilage tear of your knee or an ACL rupture or you've got a fracture, we can't do anything for that, but we can recognise it and we can tell you very quickly what it is, and more importantly, we can tell you who is the best person for you to see to get your problem solved, basically. So, Sanjay, you're one of the patients who, when you very first came to us, we couldn't help you with physio because of the injury that you had. Were you disappointed that we couldn't?
Not really. It was just, I suppose I found out what was wrong, and I just needed guiding in which way I needed to get better.
The interesting thing about your story and physio is that when you very first came in to see me, there wasn't much I could do to help.
No.
Think back, can you remember exactly? It was about 2003 you first came in to see me?
I did my knee in playing squash. I'd come back from holiday. Somebody chased me for a squash game and I was a bit overweight and knee just went. Went to the fracture clinic and all the rest of it. I thought, I've got to see somebody who knows something, because I was getting mixed messages from the NHS. So I made an appointment to come and see Paul, and effectively Paul said that wasn't anything he could do for me because I needed an operation.
You definitely with us will not get a situation where you're coming back week after week after week for a problem that we can't solve, because we would be trained to recognise it early, give you the information and put a stop to it, that you don't need to come and waste your time and waste your money with us when it's this other guy that we can recommend that you need to see. It might be that you come back to us after, for example, surgery for a knee or for a back or whatever it is, but if in that first instance we can't help you, we'll tell you pretty quickly, and we never ever charge for that session. So you really have got nothing to lose. If you're still a bit unsure and you think, well, it might not be for me, let us decide and we'll tell you pretty quickly whether or not we can help you. And just before you do go, one of the things, again, I find from speaking to my patients, one of the things I've learned, they ask a lot of questions when they ring, and rightly so, and that's why on my website there's a huge page devoted to the frequently asked questions. But on this video I'm going to tell you 3 questions that patients don't ask but should. Number 1, it amazes me that patients don't actually ring and ask directly on the phone, can you solve my problem? What happens a lot is that people find us on the website, they'll make an appointment, they'll book in and they get their problem solved. But very few people actually ask on the phone at that time of booking an appointment, can you solve my back problem, or do you treat ankles, or do you treat hamstring strains? And if I was you, I would be doing that instantly. As soon as you call, if you want to ring one of my secretaries or speak to one of my physios, ask them if we are going to be able to solve your problem. Nearly all my staff have been with me for a few years now. They're very aware of what injuries we treat and which are the most successful injuries that we can get the good outcome for, basically. So ask on the phone if we're going to be able to solve your problem, or if it's another physio that you're going to see, ask them on the phone, can you solve my back pain or shoulder pain? Question number 2, which doesn't get asked and I think that should, are you Bupa registered? Bupa is the #1 healthcare provider, not just in the UK but also across the world. It's internationally recognised, and it is so because of the standards that they set. They're extremely high, and for any physiotherapist to get on that network, it's difficult. I know myself, I had to get on it 5-6 years ago, probably more actually, and I had to jump through hoops at the time to do it, and that was just to be even considered, never mind to get on. But that's great for you and it's great for me, because it means that the standard of care that you're given is very high, and obviously it's only you, the patients, that are going to benefit from that. And number 3, am I going to get hands-on treatment? Because as I've said earlier, and I've alluded to this, there's a lot of physios now which will just give hands-off sort of treatment, which is just exercise based, and it baffles me that physios got to this point where some NHS physios are not actually even allowed to touch you anymore, and a lot of private physios have kind of gone the same route really, where they've become very lazy, or they've become so exercise orientated that they will do nothing other than in the 25 minutes that you're with them run through a whole host of exercises which you can do at home. We're here as physios, we're physical therapists. We have to give you hands-on treatment to get your problem solved, and it's my belief that hands-on treatment is 100% the best way to solve your problem in the quickest and safest manner possible. Exercises are important, but they've got to run alongside, and as I say, exercises is stuff that you can be doing at home. So, hope this helps. That gives you a bit of an insight into physio, and if you're still a little bit unsure about physiotherapy and you might be sat there and I haven't mentioned an injury that you have, please feel free to call us. You can get in touch with me, any of my physios, just ring my office. You can email me personally. paul@paulgoughphysio.com is my email. I definitely will pick it up. I will definitely respond to it, and I'll answer your problem the best way that I can. But like I say, no problem at all. If you need to ring any of my physios and you want to have a quick 5-10 minute chat, run through your problem, get your questions answered, and be 100% sure that physiotherapy is right for you, you can do that, no problem whatsoever. Hope this helps. Take care, and I'll speak to you again soon.